you do.
What I do, yeah. So like my current job, like I help run a very large military hospital in the Washington D.C. area, and so I have an interesting job now in that I get a good view of what it's like to put into practice at a large hospital level healthcare in general, and I try to do what I can do to steer my organization and provide good ideas about not only pain and function, but how to be more collaborative in a multidisciplinary team and how to put the patient more in the center of what we do. And I'm actually very fortunate to be able to have been selected for a leadership position at a hospital where I can do some of those things.
Exciting stuff.
Yeah, I think so. I mean, it's really interesting we have all these ideas. So like you work in a hospital or a large clinic, you have these ideas. Boy, if I was in charge, these are the things that I would do. And
now you're in that position.
And now I'm actually in a position where I can say, oh well, I remember when I was down there and I didn't want to have to be affected by this policy. Maybe I can change this policy, or this is some of the things I can make better. And it's a little bit like clinical practice. For our patients and our colleagues, they have all these things going on all the time. And I think we often go in kind of idealistic, thinking that we can change everything. And we really have to be realistic about the kinds of things that we can change. And we have to listen more and talk less and figure out what is a small change that I can make today that will help make this a little bit better. And so I think a big part of what we do involves looking for manageable, realistic changes that are positive for our patients and colleagues. And I'm doing the same thing at a hospital level that I do at the patient level, or that I did with the clinics that I ran.
Just with those words, you struck my chords with my current issues with my own clinical practice right now. Because it's noisy. Just remembering to think of what good can I do, the least. You put it very well. Just made me think.
Yeah, I think about a big hospital, or even like a clinic where you work. It's a ship. It's a pretty big ship in the water. You can't make a big 90-degree turn with that ship just like that. You've got to focus on where you want to go and how can I nudge that ship maybe 1 or 2 degrees in one direction and start moving it in a positive way.
A long game.
Exactly, and that's how I think about myself. That's how I think about my patients. So, I wake up in the morning. How can I be the best version of myself today? What positive thing did I do today to serve other people and to make myself a better version of myself? And same thing when I see a patient. What do I see is the patient telling me that I need to prioritize to help them change in a way that meets their goals and helps accomplish what they want to accomplish, instead of sitting back and more personalizing, okay, I know what's right, I know what the latest research is, how can I make everybody do what I want to do? I split my perspective.
Easy trap to fall into.
Isn't it? The idea that we know better than other people, and very often we don't. And so I think focusing on the smaller things that we can change, and in a way that will help move that in a positive direction, that's pretty important.
That sounds like that's your, if I understand it correctly, that's your personal motivation or your path for yourself and for your clinical practice.
Yeah, I don't see them as different.
Was that like a trial and error thing? Have you been on a different path before?
Yeah, I do. I think I definitely am. I feel like I'm better managing this now than I was before earlier in my career. And I think one of the big parts of it that really helped bring things together is that how I see myself in my personal development is very similar to how I see what I do in life with my family or anything else. My internal life and my beliefs is internally consistent with what I put out into the world. And when those two things were consistent, a lot of things fell into place. And a lot of things felt more natural. Yeah, aligning those things, and it's a better way to put it, kind of aligning those things really, really helped me do a better job on a daily basis, moving toward my goals and trying to be a better version of where we need to move.
I really love that. I love that because it's a very healthy and sustainable way. In my view, it's something that I'm 5 years in from graduating physio,
It's an exciting time. About
exciting.
5 years it's an exciting time.
Ship is rocking.
Extremely frustrating as well.
Oh yeah, but that's normal, right? You can't change if you don't have that stress, right? And we all need to change. And if you don't have that some degree of external stress to push you to change, you'll never be any different. Like I work with a lot of different people, and when I ran a lot of clinics that I've run in the past, some of the most difficult people to work with are the people with the most experience. They say, well, I have 20 years of experience. I'm like, no, man, you've got the same 1 year 20 times in a row.
Yeah, exactly.
That's not 20 years. That's 1 year of experience repeated 20 times, right? And so, but being out for 5 years or so, you're in a great time in your career. Because I know it may not feel that way to you right now, but you're at the point where you have enough clinical experience, you have enough practically relevant experience working with people in your field, whether it's training or therapy or medicine or whatever. And now you can actually begin to interrogate some of the foundational thoughts and beliefs that drive what we do. And the reason that some of these ideas stick around so much is because we don't talk about them.
Yeah.
Or if we do talk about them, it's in very sort of amorphous terms. And you never really, like what you said, you never really align those things clearly. Because when you align them clearly, then you can look at them and say, well, that doesn't make sense. Why do we do that? We should stop doing that, and we should do something else instead. So
How are we
you're
to
in a really
have that
good place.
conversation? In your opinion, what's a few good ways to start having those conversations?
With yourself or with other people?
Both.
Well, I would say that I think early in my career, I was a little bit on a mission to change other people a lot. And I think you heard that from Lars Ave-Marie today, is that's probably the wrong focus. As I look back, one of the things that made me more successful was when I stopped trying to enforce what I thought was correct on other people, and I started putting most of my efforts in terms of critical thinking and clinical reasoning. I turned them internally to myself, and I changed what my approach was. So Marcus Aurelius said over 2,000 years ago, "It is useless to escape the faults of others; they are inescapable. Just try to escape your own." And when I started to really try to work to escape my own faults, that helped that alignment, and it helped me be more consistent both internally and externally. And I started to act in ways that better aligned with my goals. When I stopped trying to change other people, I stopped focusing on what other people were doing wrong. You need to do this. You need to do. Well, don't tell them this. I'd walk through my clinic in a physical therapy clinic, and I hear the docs that work with me and our technicians explain things to patients. I would just think, oh no, what are you saying? But instead of focusing on that, I started thinking about the other little things that I could change and ways that I could take that organization and just move it a little bit. And I think I was more successful when I did that.
Yeah. It made me think about a quote. I think it's from the Bible. Don't worry about a moth in somebody else's eye when you have a beam in your own eye.
Yes, exactly.
Right?
That is biblical. Yeah, that's right. Yeah, that's a good way to put it. And I think one way to look at that is like never criticize other people. That's not really what I mean, but it's like the focus of my criticism and the focus of my process improvement. It's more internal. It's more the sphere of what I can control. And so I came into a really big physical therapy practice at a big hospital. A big military hospital, and there were so many things going on. There were so many things I wanted to change, and I thought, okay, hold on. I only have so much energy. I'm only here for a few years. What's really important for me to change? And what can I actually change? What's possible for me to change? What's reasonable that has some possibility of me changing?
Those are really clinically relevant questions as well.
Same thing with patients, right?
Exactly.
The same thing I looked at for my clinic. The same thing I
approach.
look at, right? And it's the same thing I think when I think about personal development. It's the same kind of thing.
Is it okay? So we don't have to stress in.
Yeah.
I'm getting a feeling that our second question about what about pain that interests you? Maybe pain isn't your main interest. We are painiacs, so to speak, but because there's so much about it. But is it something particular about pain that actually interests you?
Well, I guess for a long time, I thought my job. So I'm a physical therapist by training. I thought for a long time my job was the evaluation, diagnosis, and treatment of non-surgical musculoskeletal conditions. Right? I thought that was my job. Well, it turns out that's not my job. I'm actually in the business of behavior change. And if you work in a similar area to where I work, your business's behavior changed too. And
Even
I
if
think
you don't know it.
even if you don't know. And I think the same thing was true with pain. I thought I was interested in pain itself, and there are people that are who go into the neuroscience and the receptor level stuff. I don't think I'm actually interested in pain so much as I was interested in the disconnect or disalignment, as you would say, between what we now know to be true about pain and how we act in regards to pain when we see it clinically. Right? And so it's that disconnect that interests me, and that interest in kind of aligning those things and improving outcomes for patients. That's the thing that really interests me the most. And the fact that there's so much complexity in the challenge we have, and the fact that we're kind of pushing stones uphill in terms of like cultural ideas about pain and medical
like
ideas about pain.
About.
Yeah, like exactly like what Mary O'Keefe was talking about. Like, and that's been a big focus of her research, which has changed, which is really practically relevant. She's a great example of a brilliant PhD researcher who has done tremendous things to make practically relevant studies available to clinicians and people, and that's just been tremendous. What a great example of that. So I'm not interested in pain itself. I'm interested in where things are, how things have got to be the way they've got to be with the way that we treat pain in the clinic and in the medical system, and how can we improve that?
That is the everyday reality, though. So it's and it's it's not a small thing. So.
No, I don't think so either. I'm definitely more focused on the practically relevant aspects of that. I mean, I think there are people who are interested in the detailed, like the detailed neurophysiology, and you have to know some of that stuff, but you don't have to know a lot of it to be able to put it to immediate use. And that's really the part that I focus on.
Cool. I think we'll, looking at the clock, we'll have to wrap it up. But,
okay, great.
Thanks.
Yeah, you're welcome.
Thanks a lot.
Thanks,
and,
guys.
Big thanks.
I actually